samples of the abscess. Over several hours, the surgical team worked carefully on Thomas's back. It would slip and maybe damage his spinal cord, resulting in instant paralysis. It might be a simple abscess, or it could be a dangerous contagion that could infect everyone in the room.
Some nice neighborhoods have a dark side.
This is every parent's worst nightmare.
Whoever did this was emotionally attached to her. And some good neighbors have bad secrets.
We knew he was hiding something.
He began to shake uncontrollably.
A brand new series about quiet suburban murder.
To inflict that much damage on a body, it's not a typical homicide.
It's going to be somebody who knows the victim.
Nightmare Next Door, Monday at 9 on Investigation Discovery.
On Christmas Eve, Thomas Byrne had been rushed into emergency surgery.
I was very concerned and very frightened.
Doctors performed a dangerous procedure to remove a mysterious abscess from his spine. It could have left him paralyzed for life.
Many people that have that problem actually end up dead.
Even after the operation, the origin of the infection remained a mystery.
Hello, Mrs. Byrne. Hi. I wanted to give you an update.
The doctor came out and talked to me. He told me that he had made a fairly large incision on the back of his neck, and there was so much infection in there that every time we would cut a little more above would come out.
If they couldn't identify and treat the infection quickly, it might kill Thomas. It was up to infectious disease specialist Dr. Stephen Oshowitz to solve the mystery.
When Mr. Byrne came out of surgery, my concern was that he had a bloodstream infection, so it was important to find that out.
We're going to have to send it to the lab. We need a lot more tests to be done.
He said that we were going to have to do a lot of testing with him because with any infection, no matter what it turned out to be, there's always the risk of spread.
As soon as we get the information back from the lab, we're going to be back in touch with you folks to let you know what's really going on here, okay?
Thank you, doctors. Thank you both very much.
A sample of the fluid from Thomas's neck went to a laboratory for analysis, but the test would take days to complete. In the meantime, Thomas was treated with a heavy dose of antibiotics. One danger of the operation was thrombosis, when a clot forms inside the blood vessels, obstructing blood flow through the veins. The abscess had to be treated quickly.
You can imagine what would happen if that pus is left there and the spinal cord arteries thrombose. There's no more function from that level down at that point, and it's instantaneous. So even though they have no symptoms of paralysis or weakness when they come in, within 10 minutes that can change. So they don't have to look sick or weak in the muscles immediately, but they lose the function forever once that happens, and there's no going back. So getting that pus out of there, having the antibiotics get in quickly, really is the most important thing in this sort of a case.
There was circulation hadn't come from his teeth. Then where could it be from? Was there something in his medical history that they could have missed?
He asked what we had been doing at home throughout the month that he had been ill.
Then Thomas remembered what he thought was a relatively minor incident.
I was home and pushing around my dogs in the bed. And then, next thing I knew, I felt kind of like a poke. I believe I was stung by a scorpion.
Scorpions are common in the American Southwest. Most of the time, their stings aren't serious for adults. Because this incident had happened in the summer, many months before the onset of his serious symptoms, Thomas had forgotten about it until this moment. Since most varieties of North American scorpions are non-venomous, stings usually don't require treatment. When Thomas had consulted a doctor, he was advised just to take an over-the-counter antihistamine to combat any swelling. Little did anyone know that this minor sting would turn into a life-threatening condition.
Okay. Let me go look into a few things. I'll be back, okay? Okay.
Dr. Oshowitz believed he had his diagnosis. Thomas could have a severe staph infection from the scorpion sting. Staphylococcus bacteria, which occur naturally on human skin, had entered the tiny wound.
It's on me and you every day of the year, just waiting for a chance to get into us. Those germs are so small that 10 billion of them could get in through that scorpion